The best way to learn new things is through play. Games stimulate and motivate us. When we play, we're even willing to repeat mentally or physically demanding exercises over and over again until we win. Doctors are using that principle in rehabilitation centres for children. Computer games help their young patients get through the often gruelling therapy in an enjoyable way. Paediatricians, game designers and engineers developed a new game for Stefano, a young boy in Zurich.
Presenting Gabarello. The little astronaut is Stefano's avatar. He's helping the 11-year-old walk better. Stefano has brain damage that caused his mobility problems. He had an operation to improve his gait. Tendons were elongated, bones were rejoined. To get his brain accustomed to his new biomechanical situation, he has to practice, practice, practice. A rehab robot guides Stefano's legs, precisely the amount that's needed and no more. Whenever Stefano actively walks, the motion is transferred to the astronaut. Yellow steam comes out of his backpack, and that allows Stefano to pick flowers and accumulate points. Out of power and flowers means it's time to leave the planet. Stefano lets the robot take control, while his legs follow passively. But as soon as the next flowers appear, he gets back into gear.
My record is getting all the flowers in 13 minutes.
Computer games and robots are fast becoming a winning combination in rehabilitation for children. At Zurich's University Children's Hospital, a team of researchers led by Andreas Meyer-Heim is trying to optimize this form of therapy.
Neurorehabilitation is dosage dependent, and virtual reality offers a way of increasing the dosage. The patient can repeat the movements over and over again without noticing it. And the other thing is that patients are more motivated if they take part in games.
Games like Gabarello are being developed at Zurich University of the Arts. First, the designers ask the young patients about their needs and wishes. Then comes the next step.
We have to sit down with the therapists and doctors to understand their special requirements. And then we combine that with our knowledge of game design, in particular, how to generate motivation.
The hospital tests show that training with games like Gabarello does the trick. Kids who used the rehab robot to control their avatar were more active than children who watched a film during training. In longer sessions, the computer games were actually better at motivating the children than a therapist. That raises some fundamental questions. Is classical physiotherapy no longer relevant? Will human therapists soon be phased out?
No, on the contrary. I think the therapist will have an increasingly important role. There are certain patients who can only be treated conventionally. So we see virtual reality and rehabilitation robotics mainly as a supplementary method.
Stefano has profited from training with the robot, the computer game, and the therapist. Today he's walked 933 meters, and his doctors say if he keeps making that kind of progress, he'll soon be leaving the hospital and heading home.